Welcome, everyone, and thank you for joining us this afternoon for Booking Made Easy, a digital-first approach to patient scheduling. I'm Farah Hunt Thompson, Vice President of Partner Relationships for Greystone.net, and I'll be going over some housekeeping items before we begin this afternoon's webinar. We will be taking questions from attendees, and to ask your question, please use the toolbox at the bottom of your screen to submit your questions. Attendees are in listen mode only to cut down on background noises, and there is a short 7-question survey after the webinar that we would really appreciate your feedback on. I'd like to welcome this afternoon's presenters, Matthew Sluzinski and Chris Riegger. Matthew is Senior Marketing Director for Digital and Web Strategy at Rush, an academic medical center in Chicago. He joined Rush in 2022 after a decade at Mayo Clinic. He leads a team of digital professionals who manage Rush's core websites to drive engagement by patients, students, referring providers, benefactors, and job seekers. Matthew's team covers web strategy, design and development, UX, digital analytics, SEO, A/B testing, and listings management. Chris is Chief Operating Officer for Modea, a digital experience consultancy focused on combining innovative design, healthcare expertise, and best-in-class technology to improve the digital patient experience. Chris works as an executive consultant with several clients and is responsible for leading Modea's proprietary industry research efforts, including consumer-focused and institutional studies. I'll now turn it over to Matthew to begin this afternoon's presentation.
Thank you, Farah, and hi, everybody. Thanks for joining today. I'm excited to partner with Chris here to say a little bit about our project, some of our learnings, some of our outcomes, and what's going to be next from here. So, as Farah noted in the introduction, I lead the marketing web strategy team here at Rush. Just a little bit about our team. We've got 7 FTE, some pretty heavy vendor support. Kind of our biggest responsibility is managing the forward-facing web presence for the organization, which, as we know in healthcare now, is a lot of online scheduling, as we're going to talk about in this project. We've worked with Modea as our kind of core design and development agency since 2023. We've for a long while outsourced this function. So I've got a team of strategists, but we really rely on the expertise of Chris and his team as it relates to visual design, some of our user experience work, as well as all of the development work. Chris, maybe you could just introduce yourself briefly, and then we can continue.
Thanks, Matthew. Happy to. So hi, everyone. Chris Riegger here with Modea, as Farah noted. Just a quick word or two about us as a company. So Modea is a digital experience consultancy. We work exclusively in the healthcare sector and largely with big healthcare providers, health systems like Rush. And the work that we do crosses both digital strategy as well as implementation, actually designing and building platforms for our clients, predominantly in the enterprise website and mobile app space. So excited to be here, being able to present this work with Matthew. I think it's an exciting case study, and excited to roll forward here. I'll quickly talk you through our agenda. So how we plan to proceed is Matthew's going to spend some time up front, just talking a little bit more about Rush and specifically what digital transformation at Rush looks like and the different areas that they're focused on. I'm going to spend some time talking about this concept of digital first care and specifically talking about some of the more common brands in the digital first care space that and especially because we looked at these brands quite a bit as a part of the work that we did and for inspiration there. And then we're going to spend the bulk of our time really unpacking this new appointment experience that Rush rolled out towards the end of last year. And then we're going to wrap up by talking about some specific outcomes. We're going to share some real data. Matthew's going to share some real data with you and share a little bit also about what's coming up next at Rush as well. So Matthew, I will go on mute and turn it back over to you.
Great, thanks, Chris. Just a few words about Rush kind of at the outset here to set the stage. So we're an academic medical center based in Chicago. We're actually founded 2 days before the city of Chicago in 1837, so really have a long and deep history in the Chicagoland area. Relatively small, I suppose, on an AMC scale. We're a 3-hospital system, network of outpatient clinics. about $3 billion in annual revenue, and have been really proud to be on the U.S. News Honor Roll for the sixth straight year this year, and this year tied first in Illinois. Also very proud of the quality rankings we've been able to sustain through Vizient and our Rush University 45-degree granting programs. And as I mentioned, that kind of that deep-rooted health equity and community mission as well. So kind of a four-part mission here at Rush. So let's say a little bit about kind of how we got to the project that we're going to highlight today in the case study. So kind of first and foremost at the organizational level, Kaufman Hall Consultancy did a 10-year growth study for Rush a number, 2 to 3 years ago, and said that our digital experience was really one of the top 3 growth levers we have as an organization. And for context, the other big 2 were cancer service line growth, where we now have established a partnership with MD Anderson and are really trying to grow the cancer program at Rush, and expanding our outpatient footprint by opening more multi-specialty clinics in the Chicago area. So digital experience was in really good company with those top 3 growth levers. And our senior leaders really took that as some top-down direction that they gave to our teams to say, we really need to be investing in this, think differently than not only the Chicago market, but what are other digital first, as Chris will show, digital first competitors doing as well. I know many of you operate in competitive markets. Rush operates in a challenging market as well here in the Chicago area. Northwestern, which is a U.S. News top 10 hospital, University of Chicago Medicine, Advocate. There's a lot of places to choose for your care here, and Rush has made an investment, a strategic investment that digital health is foundational to not only winning new patients, but also retaining our existing patients. So a couple of the reasons for that: can we reach beyond our physical footprint? Like, we can't build a clinic in every area that we want to reach patients, but make sure that those patients we are reaching kind of slightly out of our origin market would be still able to come in for subsequent specialty care or establish primary care with us. And then strengthen our payer mix. So as we are able to diversify across geographies, can we also diversify into payers and types of patients that we were not otherwise able to reach through just bricks and mortar. So then on the heels of the Kaufman Hall work, some of you may be familiar with Avia, a digital health consulting shop that works nationwide with medical centers to look at digital health capabilities. Rush engaged them in 2022 and 2023 to do a really deep dive into current state gaps and then opportunities around digital health. So they looked at something like 44 different digital capabilities, benchmarked us against Chicago competitors, national competitors, did stakeholder interviews, started looking at a roadmap. And as you can see here, the findings were not particularly favorable in the current state, so kind of circa 2023. Fragmented, insufficient, lagging our competitors, and really importantly, lacking that cohesive strategy that was intended to provide those wow experiences to patients. Where can we take some learnings from out of industry and maybe apply those into healthcare as well? And just one example, when I joined Rush in 2022, I quickly learned that every core department seemed to have its own vendor stack. So IT was doing things, the Access Center was doing things, operations was doing things, marketing was doing things. Someone on my team was looking at an identity verification platform, and the Access Center was looking at chatbots and other online scheduling, and just was not cohesive at all. So really our priority in 2023 was, can we centralize some of this oversight? All departments put everything out on the table. What are you working on? How do those ladder up to some of the Avia findings and Avia roadmap? There was a digital transformation committee established with C-suite representation, and then a digital transformation office to do kind of the day-to-day portfolio management, and ultimately led to kind of what we started calling the 3 imperatives. So one, be the provider of choice by breaking down barriers to access, streamlining where we can as far as appointment scheduling, bill pay being 2 examples, and then ultimately drive growth and do that through new product and service offerings, but also some nudging strategies for care gap closure and retention. So we've been working that kind of in parallel, the new care offerings, which we're going to talk about today, and then some of the kind of recall and nudging things that are going to bring back patients who have maybe lapsed in care at Rush. So the far left portfolio is kind of where the project today that we're going to talk about sits. Really winning on access as a starting point last year and the year prior. Can we drive some of those new growth pathways for the organization, elevate some of the automated and personal customer service options for patients when things maybe don't go the way they should have? And then this year have launched the care transformation and operational efficiency portfolios of work. The middle one's really more about inpatient and care delivery. The far right one's more of the back office, AI, automation type activities. But the focus today, most of what I work on, nearly all of what I work on is in that digital consumer bucket. This is maybe the last kind of guidepost slide, but as we distilled down from the Kaufman Hall, from the Avia, from standing up committees and offices, this is where we've aligned kind of as guiding principles, like what's our North Star in terms of when we think about our care experience and how we make it more digital first. So radically convenient. Can we make more things available on demand or same or next day? Can we make it easy to use? And can we make it more personalized? Can we be smarter about it? That not everybody's getting the same experience, that we take what we know about you already and are able to do some personalization and some more customized outreach based on what we know about you. So these have really been our three North Stars over the last couple of years as we've started to stand up some new service offerings, and then ultimately this new appointment webpage that we're going to be showing shortly. I think my last comment on here, before I hand it back to Chris to maybe look at some of our digital first competitors, is we didn't want to lose sight of the fact that we're a top 20 nationally ranked academic medical center. So how do we leverage the strengths of that deep history and quality and clinical expertise, but also start to adopt some of these digital first, digital disruptor behaviors where they're making things extremely convenient, they're making things extremely accessible, and are starting to set a new standard for convenience. So how do we start aligning with some of that while still bringing to bear all the bricks and mortar and all the specialty care that we have that those disruptors cannot offer? And that really was the starting point, and where our new appointment web experience was a proving ground to start trying to get that right. So I'll hand off to Chris at this point to talk a little bit more about some of that digital first, digital disruptor category.
Yeah, thanks, Matthew. And actually, I forgot a really important housekeeping note up front, so I'm going to inject that real here, everyone. But we do have space at the end of the presentation for a good amount of space for questions and discussion. So looking forward to that. And if you have questions as we're moving through the rest of this presentation, please feel free to just drop them directly in chat. We'll be keeping an eye there as well. So I think Matthew did a great job just I think laying out the vision that Rush had and still has when it comes to creating something, an offering and a digital transformation, if you will, that's creating radical convenience, that is creating a really seamless experience that's hyper personalized. And so that was the vision that we brought into this work. And so in thinking about that, the goal wasn't just to go look at, well, what are other health systems doing, or what are our peer academic institutions doing? We also wanted to actually go out and just try to look at examples that we felt were particularly innovative or maybe a little bit unique in the space as well. So I'm gonna talk a little bit about what that comparison, or who those comparators are, and what they're doing that we sort of took note of as part of this work. So I'll start here with just a piece of data from McKinsey and Company that probably will not shock anyone on this call, which is that when we look at the market for digital health services, just broadly in the US, it has grown very rapidly and is expected to continue to grow very rapidly. So this assessment from McKinsey points to the fact that this year in 2025, the market's expected to reach about $200 billion by the end of this year. and is expected to continue to grow annually an average of 14% between now and 2030. And when we talk about digital health services here in this quote, it's speaking very broadly about everything related to the way that we're delivering care, like telehealth and digital therapeutics, but also just the basics of providing good access and tools digitally to our customers when it comes to things like scheduling and paying bills and managing my patient record, et cetera. So all of that together is this idea of digital health services, and we know it's what this data points to is we know it's what consumers want, and it's starting to get delivered more and more out in market, and hence the growth, right, in this space. So I want to zero in a little bit and talk specifically about this segment of those digital health services that we looked at most specifically here. And those are what we're calling digital first providers. So when we look at brands out of market that you see illustrated on this slide, like Hims and Hers or Amazon Clinic, which is now, of course, Amazon One Medical, a little bit of a rebrand there. Row, Lemonade, Carbon Health as other examples. There are others. This is not the ultimate list, but these are some of the bigger brands that we hear about, right, in market, and that have probably grown to the largest size. There are some things that these firms are doing that are a little bit unique. And so as we thought about the new appointment experience we wanted to create at Rush, we really looked at three things specifically that these companies are doing, and I want to hit each of those here. The first is that they're leading very, very strongly with brand, and they're presenting a brand vision that is distinctively modern and fresh feeling. I would call it also very authentic feeling. And so it definitely doesn't feel like a big sort of corporate experience, right? It feels like I'm going to have this really modern, really good experience at a brand like Hims and Hers from this example here. The other thing on a brand note I thought I'd share is this is maybe more current, but we're starting to see some very high-priced advertising and spokespeople too, speaking out for these brands. Many of you have probably seen our friend Serena Williams here, who is a new spokesperson for Row. And I think this is just another example of the amount of horsepower that these digital first providers are putting behind their brand and their brand advertising. So that's something we really took note of. The other thing that we're seeing be very present from these providers is a real strong focus on access. The ability to get same or next day care with these digital first providers is very high. And often they're leading with that message. So this example from Carbon Health, this is just a screenshot of their homepage from their website. And you can see how crystal clear the opportunity is to book an appointment at Carbon Health, and literally down to, by each different type of care that they're offering, when my next availability is, or when their next availability is to provide me an appointment. So, access is available and very present with these providers as well. And then finally, last but not least, would be technology. These are truly digitally forward brands. They're putting modern consumer-focused tools in the hands of their customers as well to support the care journey. And that means not only supporting digital care like virtual visits, which they are, but also putting tools like this mobile app from Lemonade Health in their customers' hands, just to help them supporting other conveniences throughout the patient journey, right? So account management, tracking prescription deliveries, and just some other conveniences as well. So those three things in particular, we thought a lot about: brand, and like what's the design, what's the brand we're putting out there, access, how we're leading with access and making sure we are providing good access to our customers, to our patients, and then just the technology itself, making sure we're leveraging the best of what we have digitally. So I'm going to turn it back over to Matthew here to talk a little bit about the jumping off point that we had at Rush at this point.
Yeah, thanks, Chris. So these have all been, like, as you can see, very visually impressive examples and tech forward and everything Chris described. And when we looked at the Rush site in comparison, this is what we had. This had been last redesigned in 2020 as part of a holistic redesign of the RushJet EDU patient care platform. The page on the left was our main appointment page. It was very much a hunt and seek, pick the tile or the link of what you're looking for. You can see in the bottom left there that we were starting to promote some of the virtual care, but it really was not differentiating at all on this page. And we still had kind of some more legacy appointment calls to action, like our appointment request form, and are calling for an appointment. We know a lot of people still, a significant amount of our patients still prefer to call. But there was really no hierarchy here. It was kind of when we added something new, we just put a new tile up, or that was the ability we had. And then on the right was our Get Care Today, or our foray into on-demand virtual urgent care that started 2020 as well with the pandemic. And you can see it was kind of it was its own microsite. It was never fully integrated back into the overall web presence. So it kind of had its own look and feel, some different interactive elements and color palettes. And clearly just together, these were kind of immature on the design front. They weren't doing a good job of helping patients wayfind the different options. And really we're just due for a refresh. And really if Rush was going to invest in modern day digital first care delivery, we need to have a scheduling experience and an appointment making experience that's reflective of that, that a patient feels like they're moving through a modern flow to then receive some of the equally modern services that we were looking to provide. So now we'll jump into kind of more of the what we did and some of the outcomes and what's next. So this project took place near the end of 2024. So we're coming up on having like a full good year of year-over-year data on it and a full year of feedback. But at the time that we partnered with Modea to build this as a project, there were a few other factors in play, kind of even more at a micro level from what I shared with Avia and Kaufman Hall. The first is that we had launched, as you saw in the last screenshot, a first in market virtual specialty care offering. So everybody is at this point kind of doing the bread and butter virtual urgent care. We saw an opportunity to actually take that model and apply it into our specialty care practices, especially for areas that were very access constrained. And we had some opportunities with APPs to open up same day, next day, same week appointment offerings in high demand areas like dermatology, urology, ENT, cardiology. So that was out the door last year, and that's been scaling up, and we knew there was more coming. So we got to be ready to kind of receive more of those offerings and promote those in a way that's going to resonate with our patients. We had also undergone, kind of led by the marketing department that I'm in, a refresh of our brand positioning with the agency Monogle. And we had a new visual design, some new brand and voice guidelines, just some minor refreshes of this and how do we try to stand out in that Chicago market that I described. And we really saw this appointment section as the website as a kind of first mover on this, that we had an opportunity to push out, as you'll see, some of the new and fresh brand positioning that at least starts to nudge us more towards some of those examples that Chris shared. And then there was a chatbot in flight, kind of led and scoped by our IT organization, where we knew there was a need to deploy this as well. So rather than just bolting that on to some of the appointment pages that I showed, could we take an opportunity to sort of parallel path these, and that by the time that we have a chatbot ready to deploy, could it actually be deployed on an equally modern looking appointment making web section? Chris, I'll hand it back to you here because I know, like, when we started scoping this project, there were a lot of ways we could go, and you and your teams have some pretty deep experience in this. There are a lot of trade-offs here, so you can maybe describe kind of what we assessed and what we went with as far as this menu of options.
Sure, yeah, you bet, Matthew. So, as Matthew indicated, once we undertook this initiative together, this project together, the ultimate goal here is to help our customers schedule, right? Help our patients get into appointments as seamlessly as possible. And that means having to somehow hand off or integrate with MyChart. Rush is an Epic organization. And so MyChart is the patient portal. And so there are a few different paths that we knew we could take. And up front, kind of early on, as we did a little discovery together, we talked through these options, as Matthew indicated. And I'll just sort of talk through these a bit from left to right. So option one is let's just accept linking to MyChart, right? We can make open scheduling available to our patients, and there are a number of different ways to do that. And ultimately, it's going to mean them having to click away from our website and to MyChart proper, if you will. And it's a really rapid approach to take because we can make that happen very quickly. It doesn't require writing any code. We're going to have to partner with IT to make that happen and get the endpoints we need, right, for the patient portal. Option two here in the middle is just a deeper integration with MyChart, right? So this would be like a proper API-based integration where we could bring the scheduling options of MyChart into a user experience that we express, right, for the end customer. And this does mean writing code. This does mean interfacing with MyChart technology resources, so that we can pass data back and forth, right, and schedule appointments, allow our customers to schedule appointment. Now, the benefit of this is we keep them inside of our design and user experience on the website, but there's a real trade-off here of just the time it's going to take to get this done, and there's some other factors at play as well. And then the last option here on the far right would be just to completely outsource, right? Pick a third party solution or product that we could sort of plug in, and that would still require integration by us on some level and configuration. It'd be a little bit more cobbled together of a user experience between our website, this product, and MyChart. So we'd have to figure that out, make it happen, but could lead eventually to a better experience than maybe a direct handoff to MyChart. Not sure. So I should say off the bat, like any of these options are imminently feasible. All of them can be done. We've certainly helped clients do all three of these things successfully. However, as we discussed it as a group, with Matthew and his team, the biggest feasibility was less the concern. However, the bigger factors we talked about were cost and complexity. First of all, just a combination of those two things, right? And then the second thing would be just how quickly which solution we can pick that's going to most quickly put value in the hands of our customers, right? Because at the end of the day, we're trying to roll out a better scheduling experience for them. That's going to help us as an organization as well, obviously. But that speed to market aspect was another big part of it, as I recall, Matthew. So at the end of the day, we decided that we would start with step one, which is just simply doing the lightweight version of MyChart scheduling and handing off to MyChart. But we decided we wanted to do that in as elegant a way as possible and making sure that we created, we didn't just pick one scheduling endpoint and dump everyone there, but we really thought about what the right endpoint was for each part of the designed experience, so that we could hand off a patient who's ready to schedule right into as far down the funnel of scheduling as possible within MyChart. So you're going to see some of that come to life here shortly. And forgive my verboseness here, Matthew, but that hopefully is a pretty good summary or overview of kind of the decision we made and why. So I don't know if there's anything you want to add, Matthew, and then I know you're going to sort of pick things back up from here.
Yeah, Chris, I think that's well said. And yeah, I think timeline. Ultimately, we did this project in 2 months.
Yes.
Once we started executing, this was a 2-month project, and I mentioned that it's realistic. This was a realistic project, and some of these other options, I think, were 6, 9, 12 more months. And
yes,
I think Rush was really interested in being a first mover on this, especially given some of the background I shared around new service offerings that were coming. And ultimately, we were willing to accept this as a sort of a bridge of a solution that allows the rest of the strategy to mature a little further. And then maybe we get into the deep or the outsource in a future state. But what can we do kind of more tactically to improve the experience on we're all budget constrained, we're all time constrained, but what are we able to do using the tools available, using the talents we have available, and be able to roll something out that's really going to impact the business in a positive way.
Yeah, and the last thing I would add to that is I think the benefit of that for this audience today is everything we share today has been fully in control of Matthew and his team on the web, or is leveraging my chart out of the box. We're not doing anything. You're not going to see anything really exotic here that is going to be really challenging from a technical perspective or even from like a political perspective either, I don't think.
So I had to synthesize all that down kind of into what was our punch list of what we were hoping to accomplish here. So we had the chatbot that I mentioned. Fabric was the vendor on that, formerly Giant, formerly known as Giant. So bringing in a symptom checker and some of the non-clinical search features. So can we get people to insurance information, parking, visiting hours more easily? The second bullet, kind of in hindsight, has become even more important as we look back over the last year, that trying to find, and I'm sure many of you are in the same space, like how do we balance promoting this digital first care while also realizing that high 90 some percent of our patients are still doing in-person visits. So how do we not lose visibility to those pathways? I'm going to show you a little bit on the look and feel about how we've worked on that and how we continue to work on that. As Chris said, maximizing out of the box my chart scheduling. So accepting that we're going to have some UX trade-offs and pushing into that my chart portal, but accepting those trade-offs given speed and the fact that we can actually link pretty deeply in there once we explored those possibilities. The new visual design that you're going to see. And then, as I mentioned on the kind of in the prior slide, just how do we build something that's a little bit future-proof that could scale up? So not only as we add new services and new offerings, can we make sure that those can be integrated, so to speak, into this experience in a way that's better than that before state I showed you with 6 tiles on a page? But also being nimble, that like we're not sure where this is all going to evolve in the next 1 to 3 years as an industry and as far as tech and with AI and where Rush wants to go as an organization. So building something that works now, but also has some scalability and nimbleness for the future. So I'm going to go through kind of a half a dozen highlights of features and some things that we delivered. So this first kind of sets around how do we bundle everything onto a single page and not have patients that have to, or not force patients to kind of dig around into a bunch of subpages to learn about the different service offerings, and ultimately get rid of that microsite I showed you with our on-demand virtual urgent care offerings. And along the way, some of the metrics we were thinking about, engagement with the online scheduling links, and then ideally less engagement with some of the more human-intensive, labor-intensive scheduling things like calling our access center or submitting our appointment form. So the first thing we're looking at, and kind of with some UX help on Chris's team, how do we want to lay this out in a way that's going to make sense to patients? So we kind of went with more of a kind of a layers or an acuity model here, and you can see this quick link strip that kind of helps the patient navigate through that. So we've kind of stacked the page from low acuity, same day type care options down through primary care, down through schedule anything you need as a new patient or a returning patient. And then kind of some backstop options like see all our services and treatments and our contact information. So that was kind of the construct, and as Chris and I have talked about a lot over the last couple of years, patients are looking at, do I want to be seen virtually or in person? Do I want to be seen now, or do I want to be seen later? And am I new, or am I a returning patient? And so how do we kind of mix and match those components in a way that's going to be the most intuitive for patients? And ultimately, we kind of stack this by levels of acuity and tried to actually blend the digital care offerings with the traditional in-person care offerings. So we got the kind of video capture here, kind of starting from the top, as you'll see what we've branded, I'll talk about this a little later, our Rush Connect digital first suite of services, the on-demand urgent care, our new on-demand or same-day, next-day virtual specialty care, making sure we bolt together the virtual urgent care with the walk-in care locations. So we've got physical walk-in cares that treat a little more expansive of conditions than the virtual urgent care, but make those available as well. The virtual specialty care portfolio, as I mentioned, we're the first in the market to be doing this, and we'll take a look at this in the next slide, but kind of designing an experience that through a nearly one-click scheduling experience, you can see the next times and days available for those high-demand specialties. Our primary care practice, and then the schedule any appointment. So as we get down to the kind of bottom of the page here, make sure that there's significant visibility to, if you didn't see what you needed earlier, here's where you go. And this is actually our most used quick link out of that strip that I showed was patients getting into this new or return patient flow. And then having some pathways here too for our callback form and our phone number. With virtual specialty care here, we had designed a couple templates out of this project with Modea's help. So this was more of our kind of core services template, where in some cases we do need to host more explanatory content about a program. It can't all just be sort of click here to schedule type calls to action. So we offer a lot of those one-click scheduling back on the main page I showed you. But then with more of these deep services pages that we've built for virtual specialty care and our urgent care, and a few other areas now, we're able to kind of talk about how the service works, how this might be the right fit for you, what conditions can we treat, how much is it going to cost, who's eligible for it. And then ultimately from these pages, the patient can schedule or at least see appointment availability with a single tap or click, just like they could on the main appointment page. You saw there, we've got the chat bot, which we named Isabella, kind of floating in the bottom right there. This is the fabric provided widget. So we've got up in that hero space kind of engagement with the chat bot, and then it sits in the bottom right corner of every page on rush.edu at this point. And some of the key features here, we're triaging patients through a symptom checker into care endpoints, helping them find care outside of the symptom checker. So moving them through a workflow for virtual urgent care, primary care visits, or any other types of visits. And then what I mentioned earlier about the non-clinical information, can we tamp down on calls we're getting about what should be easily findable things on the website or through the chatbot, like visiting hours or parking, or in some cases, billing or insurance questions. So the chatbot really is set up to go to the same endpoints as the website, which would be, say, scheduling endpoints, our Find a Doctor directory or locations directory. And I've got a little data I'm going to share at the end of this in terms of some of the engagement we've seen with the chatbot. We also designed what we started calling these care bundles. So these are more persona-based page designs that bring together the virtual specialty care services I described previously. So all we've done is take the conditions we treat out of now OBGYN, derm, ENT, cardiology, a few other areas, kind of split those off. We've got a women's health page, we've got a men's health page. We've also integrated, as you see in the bottom left here, some of the in-person care screening. So this is another example of how do we continue to blend that digital first and the in-person care that for women, breast cancer screening, heart and vascular and lung cancer, like we've got self-schedule screening opportunities for patients. They obviously need to come into a clinic location to do that. But a page like this gives us an opportunity to sort of front load some of those same and next day care offerings at the condition level, as you see on the right, also starting to bring in some of the in-person care as well. And so these pages have been great, not only to kind of put out some persona-based pages and care offerings, but also provide some really strong landing pages for campaigns, paid campaigns that we're doing in support of these. And in addition to men's and women's health, we launched a couple months ago medical weight loss, like a very high demand area, as we all know, in the digital disruptor class. and then some sports and fitness performance bundles and conditions as well. So it's been exciting to see the growth of this and just being able to think a little differently about how we package these up and make them available in an intuitive way for patients who kind of want to self-select into this type of persona. And then Chris kind of shared the one-click, or we call the one-click scheduling. So from like those tiles on the left that were on the last page, and actually from many of the links that we have on our main appointment page, you're literally clicking the name of a condition, and you're going to see the next available times for a provider who's going to treat that condition for you. So our kind of service level promise on a lot of these is same day or next day video visits. And I think it's been exciting to be able to like, kind of explore how deep we can go with the linking into MyChart here. That one of our guiding principles is don't send the patient back upstream. So when they click heart health, we don't ask them what they want to be seen for. We don't ask them what specialty they want to be seen in. We know that they clicked heart health. We're showing a list of heart and vascular providers here who have the next available video appointments through this service. So this, I think, is like one of the strongest value adds out of this project, and actually one of the strongest comparisons to some of the digital disruptors that Chris shared. Being able to maximize that the MyChart experience to the best we can, accept the trade-offs that we described earlier, the look and feel, the kind of crossover that the patient has to do from our unauthenticated website into this, in this case, MyChart open scheduling, unauthenticated flow. But just accept that in service of being able to expose these days and times right to patients with one click.
Hey, Matthew, just to chime in here.
Yeah.
I think this will be helpful just on a practical level for all those who are attending this meeting, this webinar. But if you can see on this lockup, for instance, this is if I recall from the women's health page we just looked at on the last slide, Matthew, and there are 15 options here for different appointments you can have for 15 different conditions. And I think this is a good example of, we on the one hand, as Matthew said, we're leveraging MyChart right out of the box, which is great because it helped us get this to market faster. We did have to work, just practically speaking, with the the appropriate IT folks at Rush to help us to get to all these right endpoints. And if you spend some time on this scheduling experience on rush.edu on the website, you'll see lots and lots of places where we had to insert some kind of custom unique scheduling link back over to MyChart. And so there's some complexity here. It's just not technical complexity. It's really about us plotting out what is the best user experience. And so that took some work and coordination, as I recall, Matthew, with some of your counterparts in IT who were great and were able to get us everything we needed to make this happen.
Yeah, that's a good call out, Chris. There's not technical complexity, there's just sort of manual complexity that each of these links has to be generated to go to the right spot. And then we have to keep track of when new providers are kind of added into the service, or do we have to update the link to capture those at the location they're seeing patients at. So I would call it more of like a data management situation, but there's really no technical complexity to it. It's just how do we maximize what's available out of native MyChart as far as making these links available. And sending patients, as I said, as far down the funnel or the tree as we can based on what we know they've clicked on the webpage. All right, so a little bit about kind of the outcomes, the data, the hard data that we've seen since launching this. This went live in November of 2024. So as I said, almost a full year of data in play. So we've been able to boost appointment page views by 79% since this went up. This was a function, I think, of not only redesigning a more engaging page, but also being more deliberate about how we're driving internal traffic to this page from different spots on the website. And in some cases, starting to use like anchor and jump links to move patients up and down that page based on, as it like kind of the earlier example, like where we know they're coming from. If we're linking from a cancer service line page, it's probably likely they don't need virtual urgent care. They probably do need to get into the newer return patient flow instead. And so how do we maximize how contextual we make those links and jump people to the right area? And I mentioned some of the other performance measures we're looking at the outset. So can we drive up engagement on the MyChart scheduling links? We've been able to do that by 25% year over year. Can we tamp down engagement on some of those more labor-intensive scheduling options? We've also been able to do that year over year. 16% decrease in phone calls generated off the appointment page, 8% decrease in those appointment request callback forms generated off the appointment page. And then in that virtual specialty care portfolio that we've really been trying to emphasize hard over the last year, kind of before and after this redesign, we've seen a 3.2x average monthly increase in appointments for that service. So increase in visibility, increase in ease of scheduling has really told a nice story where we continue to see quarter over quarter growth of that portfolio. As far as the chatbot's concerned, some of the data we have through August, this past August here, 81,000 people engaging with the chatbot. At some point in the symptom checker flow, they get asked if they've been seen at Rush before. 9,700 people had not been seen at Rush before. This is a really good metric for us. Like a lot of as I said, the digital first care offerings are really intended to capture and acquire patients who do not currently have a relationship with us. So whether that's the virtual specialty portfolio or even things like this chatbot, where we're making it easy for patients who have yet to use Rush services, making it easy for them to find and use Rush services. And also seeing that a really heavy percentage of these chatbot interactions, at least the ones that are completed all the way through, lead to patient care endpoints. So the most common uses of this chatbot are finding care. How do I make an appointment? How do I find a doctor? How do I find a location? And then kind of the wild card in the top 5 is find a job at Rush. So we're seeing like a mostly patient care activity in that chatbot. And then as far as some of the non-clinical queries, it's things like finding jobs at the organization. We also, on my team, kind of run a comprehensive conversion rate optimization program, and we've applied this, I think, as soon as a couple weeks into go live of this new web experience, applied some tests into here to see what we can do to help lift some of our other kind of intermediate measures of success. So one thing we detected early on was that a significant percentage of people who viewed our appointment page, their prior page was also the appointment page. So people were looping onto the appointment page. And we suspected it was because we had in our masthead or in our global nav there a make an appointment button that people were clicking on despite already being on the destination page. So we tested hiding that. We were able to reduce the proportion of people that were kind of re-looping or reloading that page by 31%. And then ran a number of tests on those quick links. That was a really early area of focus for us. And to some of the points I made earlier about some internal sensitivities about not over promoting some of the digital first care at the expense of our more traditional in-person care options for the majority of patients. So we tweaked quite a bit of wording in that quick link strip. We reordered the quick link strip kind of one at a time on a test-by-test basis. And one highlight was the button currently labeled schedule any appointment. We had called all appointment options, and we saw a 25% uptick in engagement on that button when we relabeled it schedule any appointment. And that's kind of arguably our most important button, was like getting patients into that new and return patient flow near the bottom of the page that I mentioned. So really good data on this. And we continue to apply some of these tests onto this page and onto a lot of our other service line pages in service of continuing to drive some of those KPIs in the right direction. So I'll close with this, kind of where are we going to go next from here? The virtual specialty work continues to be an area of focus for the organization. We're poised to launch cancer second opinions and transplant intake and consults through this service in the course of this calendar year. So excited to kind of get those plugged into the experience I just showed you here and really create some strong messaging and landing pages for patients who are seeking those services, and where Rush can create access in the market that does not currently exist for those patients. We've also been looking at what's next on just the appointment experience itself, kind of the holistic side of everything I showed today and that Chris described today. Do we want to move more into that deep or that outsource model? How can we maybe craft an experience that continues to be even less hunting and seeking, where the patient's expected to basically click on what they want versus tell us the symptoms or the condition or the treatment you're looking for, and we can surface kind of a rank order sequence of care options at Rush that would be applicable for them. So I think that is something we started looking at this summer and that we expect to be doing over the coming 12 months. We also launched what we think to be like a nearly first in nation virtual healthcare subscription called Rush Connect Plus. This went live a couple months ago. You can find it out there on the Rush website today, but bundling 24/7 pay-per visit virtual urgent care with 7-day a week access to an access center live human navigator that can help you with coordinating appointments, solving problems with bills, finding you the right specialist, and being able to do that by phone or live chat 7 days a week. So the new appointment section's really been a platform and a launching off point for helping to promote that new service offering as well. And we've paired this all with a pretty aggressive ad campaign, including this out-of-home piece on the right there, where trying to be a little more loud, a little more bold, a little more aggressive in market in terms of positioning Rush as a leader on that digital health front, on the technology front, and really trying to continue to draw those distinctions I made where Hims and Hers or One Medical can do certain things, but they're not backed by the clinical depth of a top-ranked academic medical center. So we'll match them on convenience, we'll match them on access, and then we're going to do things they can't, like back it up with really strong downstream specialty care. Thanks everyone for your time today. I know we'll take a look at some of the questions we got during the session here, and I know there were some that were submitted previous or in advance as well.
Yeah. Yeah, please, for those of you who are with us, take a few minutes and drop any questions you have in chat. We've got a few already, Matthew. Maybe I'll sort of feed these to us here a little bit. Some of which I think we covered here, especially in these last couple of slides where you talked about outcomes. The first question was just, have you been able to integrate web tracking analytics into the web experience? Clearly, yes. We're getting measures on this new area of the site. A follow-up, you spoke to this a little bit, Matthew, but do those results reflect the changes you were hoping to see so far?
Yeah, they do. Like as more data has come in, especially now that we've got I think 10 months of year over year, there were some kind of like ups and downs, especially the phone call situation and those appointment callback forms. The engagement with the scheduling type links was up immediately and has remained up. But as we kind of got to this summer and got more data on the year over year, we are seeing now that net decrease in a good way on phone calls into our access center and on the appointment request callback form, which aligns with where the access center wants to go in terms of keeping that available for patients, but really trying to emphasize the online scheduling for any appointment, not just digital first appointments.
Yeah, great. Another question, this one's specific to the chat bot. You shared some data already, Matthew, just indicating just kind of the volume of chats coming through and the types of customers that were coming in. But any just sort of like a qualitative sort of user sentiment about the chatbot and what's that feedback been like, even if it's anecdotal? Is that something you've captured yet?
Yeah, that is something that's captured in the metrics for it. And I took a look at this in advance of this webinar. It's about 50-50. Like people are asked, like, I don't know what the words are at the exact end of the chatbot experience, but like, were we able to help you today? And it's kind of like, half and half. So there's clearly some improvements to make. And like one of the other projects on the roadmap for this year is what does next generation chatbot look like? Can we escalate to a live agent in the access center at certain points? Can we use more conversational AI versus kind of this algorithmic decision tree AI that I don't think is really AI. It's just kind of setting up workflows and algorithms and trees to kind of move patients through the chatbot. So it is on the radar. Like, we've got to figure out how that's going to work and who's going to staff it. But there's clearly some improvement opportunities. The other one we have not looked at yet in the chatbot, but plan to, is integrating more open scheduling endpoints directly into the native chatbot experience. So rather than it surfacing like a MyChart link to primary care, would it actually say John Smith, MD, primary care, here are the appointment slots, just like you'd find through our provider directory. So quite a bit of areas of improvement for this, but I think it's been like a pretty good version 1 for us.
Yeah. So that with what you just said last there. So first of all, those questions so far came from Seth. Seth, thanks for your questions. That last comment you made, Matthew, I think addresses a question that came through from Sean about whether or not a user can schedule an appointment directly within the chatbot conversation. I think the answer to summarize is today, no. Today,
Correct.
it linked to a scheduling page. But it sounds like that's already being explored as a phase 2 potentially of just
Yeah,
bringing
that's right.
scheduling
Bringing
experience.
that forward into
Yeah.
the Yeah, and I think, Chris, like when I think about that, it's kind of what you described in that light, deep outsource, that at some level, all this is, not all of it, but a lot of it's just exposing open scheduling into different channels, bringing it forward into
Yeah.
the unauthenticated web page, bringing it forward into a chatbot, bringing it forward into third-party platforms that exist outside of our own owned domain, and continuing to chip away at that and figure out which ones are going to be the highest impact.
Yeah. I think just I'll inject a little bit of I don't know, my own sort of like experience from other client work here as well, and say that there's a lot of attention right now on chat. There's a lot of attention right now on just search in general, site search in general as well. And what the data says is that more and more consumers are expecting to be able to have more of a conversational experience to get things done, because that's how they're being trained to, to interface with brands like us, right? In other industries. And voice search pushed that higher. Now generative AI is pushing that even higher. Tools like Chat GPT. So I like that paradigm of what more can we keep inside of the chat experience for them, because I think more and more we're going to see that happening on the web. Um, I think a pretty straightforward question from Catherine. Any next steps regarding imaging scheduling? Is that something you're considering at Rush?
Yeah, that's probably slightly outside my lane on this. A couple things where I know are being worked on in our access center, kind of like making sure the patient can schedule that upon leaving the office. One, because I think that's not done well or consistently today. Imaging, though, has also been a component of some of our care gap closure work that I very briefly mentioned at the opening. So really more in that existing patient or returned patient space versus new patients. Like, we opened a new outpatient multi-specialty location a couple months ago, and we did a campaign to direct patients who have open imaging orders to go schedule an appointment for that at this new location that might be close to them, and saw really good success, like hundreds and hundreds of imaging orders that were scheduled that were like otherwise lapsed or open. So I think it's really been more of that's been more of a focus of some of the care gap and campaigns, more so than the work we've done here today.
Thanks. Got another question here and by the way, Farah, I'm just rolling here with questions. So hopefully that's all right. I know we're at the top of the hour, but I've got a few more minutes, certainly, and I'm happy to field
Yeah.
more.
That's fine.
Okay, thanks. Farah's in charge, everyone. So just want to check in with her. So a couple of questions from Michael that I want to speak to, and I'm happy to take the first crack here if you want.
Yeah.
But about under options for our technology approach, our MyChart approach, if you will. Michael asked the question, I've heard that Epic is trying to phase out the option for deeper integration and outsourcing to a third party. Is that true? And did that factor into choosing that lighter weight approach? I guess I can take the first part of this, and I'll let you, Matthew, address to what degree you feel like that factored in for you and your team. But what we can say definitively is Epic certainly doesn't want us doing that deep integration. And when I say us, I don't mean Rush. I mean, in general, us as healthcare providers, right? Like they are very focused on building the MyChart brand and making that the go-to tool for patients for their health record, including for scheduling. And we all know this, right? Like they're continually rolling out new tools, most recently their own provider finder tool. So they're starting to push more and more into that consumer space. So I can say definitively, Michael, that they have come to our clients who have a more custom developed integration and basically communicated that they're going to be raising the costs of that API access to them. And I think they're starting to take steps to try to tamp down on those integrations, those types of deeper integrations. I can't speak as much to the third-party platforms, but I would imagine it's probably pretty similar. But hopefully that's helpful answer. And Matthew, anything you want to add to that? Or, I mean, certainly that's part of the complexity here, right? If we had chosen to go right out of the gate with a very deep integration, there could have been more cost involved from a MyChart standpoint.
Yeah, I think it's well said, Chris. You're probably closer to this, like the kind of the industry trend on that than I am overall with Epic. But yeah, I wouldn't say it played into this project specifically. I think really we were on a timeline constraint and on a budget constraint, which led us toward how can we maximize that light approach. I mean, I think like back of the napkin was like 5x more costly, 5x longer if we wanted to go into the deep approach versus the light approach we did.
Yeah.
So pretty significant, and obviously just in terms of resource commitment and where can we get some early wins, we went with the approach we did.
Yeah, well said. Last question here is also from Seth. But I want to go back to it because I think it's an important one, and it really just goes back to how are we measuring ROI from this. And he asked the question specifically about if we've been able to not just measure the on website interactions, but also the throughput into actual appointment schedule. You did share some data, Matthew, on the increase in virtual specialty care appointments. So I think there is clearly that kind of measurement happening. But I just anything you want to add to that?
Yeah, I'd say this is a great question. I think Rush, I mean, candidly, has some room to grow on this in terms of how we attribute the value of that appointment back to the work we did on the website or the marketing overall. So I'd say it's been more on like a case by case or campaign type basis. So like that virtual specialty care is a good one. We're doing the same on this Rush Connect Plus portfolio. Or with the virtual specialty care, like we know we've through the data know that 1 out of every 2 of those virtual specialty care appointments turns into a follow-up in-person visit, and we can put some revenue and contribution margin figures on that. And those visits then turn into imaging and procedures, labs, other things. And then just looking at kind of the cohort of what were the types of patients that are coming through that service. So like in that example, it's 80% commercial pay, 96% new to practice, 26% new to the organization. So there's some numbers that we could put on that too in terms of what outcomes we're having. But yeah, like we've got some maturity to do this at scale. Like I don't have a dedicated analytics team on my team. Like we're using some shared services around the organization and really trying and then navigating data privacy and the HHS guidance and like what are we doing in terms of data sharing across platforms? How do we do that in a compliant way? So I'd put that generally as like room for growth, opportunity for Rush.
Yeah, that's great. Well, those are all the questions we've got. I know we're 5 minutes past time, and just thank you to all those on the call who stuck with us this whole time. Sorry we ran over a few minutes. And thanks so much for joining us. Matthew and his team are great partners, great clients of ours, and we're really proud of the work we've been able to do with them, and exciting to be able to share it with you. I know as we wrap up here, I see it came off mute, Farah. I know there's a survey that's made available for all of us once we drop from the webinar. So just I'll give you a heads up to look out for that. We'd love it if you could fill that out for us.
Yes, please. We really appreciate your feedback. And I want to thank you again, Chris and Matthew, for being here and for such a great presentation.
You
So
bet.
we hope that you guys have a great rest of your afternoon, and we'll see you soon.
Yeah. Thanks, Farah. Thanks, Matthew. Thanks, everyone.
Bye.
Have a great afternoon.
Thanks, everyone.